part 2 of our shoulder pain series. So today we're going to be talking about what it looks like and what you should expect from a conservative management of rotator cuff and bursitis injuries, when to have an injection or when to stay away, and whether you should look at getting surgery in the future. So if any of those things are questions that you wanted to answer, I strongly recommend continuing to watch this. So, what to expect in the early stages of treatment? Definitely, someone should be looking at your range of movement, so how far you can move your arms. They should look at your aggravating activities, and they should also look at how the pain is affecting what you are doing. So that way, they can really cater and change treatment depending on what you want to be able to achieve with your shoulder. There's thousands and thousands of exercises that you can be doing, and some are better for people that want to return to golf, and some are better for people returning to swimming, and some are better for people that just want to be able to use their shoulder and get changed. So these are the different things that seeing a physiotherapist or a health professional will be able to cater for. Treatment wise, what you should be getting is some soft tissue massage. A lot of the time when you've injured something, there's a lot of aggravated muscles. So thinking back to the previous series, or the part 1 of this series, is that the ball hanging from the roof with 4 strings, if you cut one, the other 3 work more. So that builds up tension and builds up pressure and causes knots to create in the other 3 muscles of that rotator cuff. And then education. In the early stages, it's really important to get a lot of information of things you should be avoiding and things that you should be doing for your shoulder. Exercise wise, a lot of people always want to go into the strengthening straight away, but it should be looking at assisted ranges of movement, getting the shoulder, making sure that it doesn't get tight and that you can get all of the range of movement with a bit of help. Education wise, you should be told probably not to reach above your head, not to do the aggravating activities. They should go through your scan results so that you actually understand what all the big words on the scans mean, and then not doing things that are painful. Because the goals in these early stages, which is your first 2 weeks, is reducing your inflammation and regaining that assisted range of movement, making sure that your shoulder is in a good position to begin strength. That brings us on to the 2nd to 4th week of your shoulder rehabilitation. So assessment wise, strengthening of the shoulder should definitely have been assessed by now, and then looking at your neck and your spine movements, because a lot of the shoulder muscles attach into the spinal column, and that's important to look at because that might have been what caused the overload to your shoulder, or it might just be symptomatic because of how your shoulder is now. Treatment wise, soft tissue massage into muscles, same as last time, and then also looking at muscles that you're beginning to strengthen. As you strengthen muscles, they will get tight, and removing that tightness is important to make sure that you can continue doing your exercises and progressing. The physiotherapist might talk about taping for posture. Correcting that posture offloads a lot of the pressure in the rotator cuff muscles. If you have that rounded posture, that's 70% of increased force through those muscles, means that 10 kilos you're lifting becomes 17, so that's important. And then some biomechanical training, starting to get that shoulder moving the way that it should be. So exercise wise, we've got just active movements, so looking at shoulder movements in laying down, progress that to standing. You've got your TheraBand exercises, TheraBand tied around the door handle, pulling it into your stomach, taking it from your stomach out. Those should all be pain-free. If they're painful, then you shouldn't be doing those exercises yet. And then you've got your postural rows, so tied around the door handle and pulling your shoulder blades and your elbows back, making sure it's not a shoulder movement and that it is a postural strength. All postural exercises should be held movements. They shouldn't be 1, 2, 3, 4. It should be pull and then count to 10, because posture, you need to teach your body to hold the movement. Education wise, working within your limits and activity modifications as required. So this is looking at changing the way that you sit at your car so that you're not aggravating things, changing the way that you're sleeping. So goals for this stage is getting your full active movement of the shoulder and beginning that strengthening of your shoulder as well. What to expect at the 4 to 8 weeks. So treatment, a bit of soft tissue beginning to move towards just looking after your shoulder independently, so strengthening gym work and joint mobilization. So with the rotator cuff, it can stop the capsule and the shoulder from moving the way it should be. So sometimes some joint mobilizations are required to stretch out that capsule and allow the shoulder to have the movement to get that whole range. Exercise wise, we're looking at body weight strengthening now, progressing postural strengthening. So a lot of early stage postural strengthening is double arm. You want to look at single arm rows because you don't get to put your arm out to reach for something with both hands. We normally do it one at a time. And then dumbbell exercises. Education wise, it's encouraging that home exercise program. This is what's going to stop this from coming back in the future. If you're definitely in an acute stage, then if these stages aren't completed properly, then it will lead to a chronic injury in the future. So it's making sure that you're following those steps and then graduating the shoulder use. Goals of these stages are being able to groom yourself, being able to shower, being able to get your bra on pain-free. These are all things that make a big impact on our life, and we want to gradually get them back between the 4 to 8 weeks. And also look at correcting posture. By now, we should be more focused on setting up the correct posture every 20 to 30 minutes, and then holding that for as long as we can, and then resetting it once you've lost it after 30 minutes or so. And then what to expect at 8 to 12 weeks. So treatment, there shouldn't be so much hands-on. It should be a lot of gym strengthening. Exercise-wise, you're looking at proprioception exercises. This allows your shoulder to know where it is in the joint, because if you get a knock to the arm, or if you just throw your arm out to the side, we get a lot of people at the end stages get lots of clicking and pain from this because they're not used to that. You've held your arm very protected for 8 to 12 weeks. So it's now important to build up the confidence of that shoulder to be doing the things that you want to be doing. And then functional strengthening exercises. This is where you start really building up your strength if you're a swimmer. This is where you start really working on your golf swing and the different things that are causing problems with that. Goals at this stage is return to your hobbies and not having any problems with your shoulder. If you follow these stages, then you should really be on top of your shoulder, and the likelihood of it returning in the future is quite low. So that success rate, if you can lift your shoulder up in front of your head with a straight arm, is 60 to 90%. So depending on what your work is, it should be a really good outcome for your shoulder. So a lot of the time we get people, especially in their initial consult, and they've been told that they've got a bursitis or they've got a rotator cuff injury, and that you could get a cortisone injection or you can see a physiotherapist by their GP. And so does an injection help? With bursitis, an injection is really good at reducing the inflammation of bursa. It's the exact same as sort of taking an anti-inflammatory, except it's specific right to the inflamed area. However, it doesn't correct the biomechanical cause of the inflammation. So these are the sort of things that we see people get the injection, and then a month later they get another injection, and then 2 months later they've had a third injection, and then have no option but to see a physiotherapist. And that's because it reduces the inflammation for 2 weeks, and then it slowly starts to build up and aggravate the bursa again because you haven't fixed that posture, which is the main cause of bursitis. So what I always suggest is physiotherapy, do about 4 weeks, and if it's still not reducing the pain quite so much, go get the injection and then continue off with the rest of the physiotherapy, because that way you're correcting the biomechanical cause of the inflammation, and if you take the injection right at the start, you're still going to get that 2 weeks of aggravating activities, because it takes at least 4 weeks to build up your full strength enough to not aggravate your bursa and to have the correct posture. And then rotator cuff injuries. So injections into the rotator cuff for tears or tendinopathies have been shown to have really good short-term relief. However, they also have shown recently to cause tendon weakening and the thinning of the muscles. So what we've found is people that have had injections into the rotator cuff muscles previously, 10 years later, they're starting to get tears and just degenerative muscle fraying, and you want to try and avoid that. So we always recommend not getting the injection into your rotator cuff muscles. And we recommend that to GPs as well when we go off and do talks to them about shoulder. And lastly, we get told, should I just look at seeing a surgeon? So we'd recommend surgery if you've got a rotator cuff injury, usually for patients younger than 60, if it's a complete tear, and if the employment or your sporting activity requires constant shoulder use. If you fit all of those things, we'd look more at getting surgery straight away because you need to follow physiotherapy afterwards. However, a lot of surgeons and a lot of people should try a conservative approach to physiotherapy. So if you have no improvement after 6 to 12 weeks, we'd recommend surgery as well if you fit the criteria. I hope that this seminar has been really beneficial. Go back and have a look at the part 1 of the series if you haven't seen that as well, and look out for more information on your shoulder pain.